Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Hello, and welcome to the AUA News Inside Track. I'm here today with my colleagues Mike and Vanessa, and we work in the Governance, Advocacy, and Policy Division within the AUA. We work in the DC office, which, if you didn't know, aside from our Linthicum, Maryland headquarters, that we do have a DC office because we work full-time with federal lawmakers and regulators on Capitol Hill. We also advocate at the state level, but today we're focused on a federal issue. And our work impacts the practice of urology, our members, and their patients. And to kick off our conversation, we'll start with brief introductions and then get into the crux of this conversation, which is advancing a federal bill to advance the state of men's health in the United States. My name is Melika Zand, or Mel, and I'm the Patient Advocacy Manager at the AUA, and I work to incorporate the patient voice in all of our federal, regulatory, and state advocacy policy issues. And I'm going to pass it on to Vanessa.
Thanks, Mel. My name is Vanessa Cramer. I'm one of two federal-level lobbyists representing the AUA on Capitol Hill, and I oversee AUA's engagement with House Ways and Means Committee members as well as Senate Finance Committee members. Kicking it over to my counterpart, Mike Collins.
Thanks, Vanessa. Mike Collins, also one of our lobbyists, and I manage our relationship with the House Energy and Commerce Committee, and on the Senate side, the Committee on Health, Education, Labor, and Pensions.
That's right. So to connect the dots here between Mike and me, we have what are referred to colloquially here in DC as the four corners. We have all four corners covered, and they're called the four corners because these are the congressional committees that have primary jurisdiction over health policy issues. And as a matter of course, any health-related legislation must clear these committees to advance.
Right. Now, we do also work with members who are not on those committees, but our primary focus is those committees.
That's right. And that's an important point to emphasize. Pretty much any federal issue that comes up is fair game, and the AUA is watching and engaging where and when appropriate.
That's a great segue. And we work on many policy issues at every level, right? But one of the major policy issues that we've been focusing on this year is working to advance men's health. Mike, can you tell us a little bit more about the state of men's health and what's going on in the United States today?
Sure, thanks. Well, the overall picture of men's health in the United States is pretty ugly. You might even call it a public health crisis. One of the best indicators of that is life expectancy. Life expectancy for men is 6 years shorter than for women. And there's no biological reason for this. If you go back about 80 years, say into the 1940s, those numbers were tight. The life expectancy for men and women were essentially the same. Then for some reason in the middle of last century, they started to separate. And so we've had a 6-year gap for many, many years. And frankly, no one really knows why. We do know that today about 53% of male deaths occur prematurely, meaning they occur before age 75. Men are more likely than women to die from preventable causes like heart disease, diabetes, strokes, liver disease, and pretty much any of the top causes of death you can think of except Alzheimer's. Men are also disproportionately affected by what we call deaths of despair. Those are deaths caused by mental health issues or substance abuse. In fact, about 80% of suicides in the United States are committed by men. Obviously, these trends are bad for men because they're getting sick and dying too early, but it's also bad for families. People lose their partners, people lose their parents, and family members are forced to become caregivers, which just creates a lot of stress. There's also a cost to society. The total cost of direct and indirect costs related to the top 5 premature causes of death is about $420 billion a year. That's about $120 billion in treatment costs that impacts the whole healthcare system. We have more men seeking treatment, and that impacts workloads for sure for our doctors. And then about 300 billion of that is lost productivity, lost wages, lost economic activity, that kind of thing. Now, unfortunately, there are no federal programs designed to treat this as a public health issue. Of course, there are programs on disease states and things like that, but there's nothing that looks at the big picture problem. Th- Fortunately, there are some activities going in the states. About 17 states have some sort of program designed to address this issue, but there's nothing at the federal level. So, Vanessa, could you tell us about what AUA is doing to change that?
Yeah, thanks, Mike. That's a rather grim picture you painted with those statistics there. So this year, AUA's advocacy staff has worked with Representative Troy Carter, who is a Democrat representing the 2nd District of Louisiana, alongside Representative Dr. Greg Murphy, who is a Republican representing the 3rd District of North Carolina, and importantly, a practicing urologist and AUA member. We've worked with both of these members of the House, the U.S. House, to introduce the State of Men's Health Act, our H.R. 7602. And importantly, having bipartisan lead sponsors like this out of the gate is considered a legislative coup. Mike is going to speak shortly to the legislative strategy piece, but bipartisanship is the name of the game here in D.C. So the bill was introduced in February. This was just in time for the AUA's annual Urology Advocacy Summit in Washington, D.C. And for those of you who are uninitiated, this is our annual event wherein we fly in hundreds of AUA members to come to Capitol Hill and meet with their congressional delegations about issues impacting the practice of urology. So this, of course, presented a great opportunity to raise visibility and drum up support for the legislation. So what exactly does the bill do? It does two things. First, it requires a study by the Government Accountability Office, or the GAO, which is the nonpartisan research arm of Congress. This study is in the spirit of evidence-based policymaking and will help establish a baseline for further action. Under the bill, the GAO report is required to identify men's health disparities and recommend targeted action for reducing them, evaluate existing programs and how they can be optimized to be more efficient, as well as assess the federal research landscape and identify gaps and areas of unmet need. Second, and the main crux of the bill, the sizzle on the steak, so to speak, is that the bill would establish a federal office of men's health within the U.S. Department of Health and Human Services. Now, significantly, this Office of Men's Health would be housed under the Office of the Assistant Secretary of Health, or OASH. In D.C., we love our acronyms. This office just so happens to be headed by Dr. Brian Christine, who is a urologist and AUA member himself. OASH also contains the Office of Women's Health, and the idea is that the two offices would complement one another and work in tandem. The bill specifically states that no funding can be taken from the Office of Women's Health in order to run the Office of Men's Health. So what would this Office of Men's Health do? Its charge would be to support and coordinate existing programs and activities that promote the health and well-being of boys and men. These include public education and awareness campaign, various screening events, and other such activities. As Mike alluded to, these activities are ongoing in 17 states, but there currently is no centralized mechanism at the national level to coordinate these activities or to elevate effective models. And this Office of Men's Health would operate as this umbrella. Along those same lines, the office would establish and maintain a database of best practices, clinical guidelines, clinical research, and funding opportunities around men's health. These would, of course, include AUA guidelines. So now that we know what the bill does, Mike, do you want to walk us through the legislative strategy?
Sure. Thanks, Vanessa. Now, to get the State of Men's Health passed in the House of Representatives, the first order of business is to persuade a critical mass of representatives to formally express their support, and they can do this by becoming co-sponsors. The more co-sponsors a bill has, the more likely it is to move along through the process and get to a vote on the House floor. There's no magic number. You just got to start plugging away at it. Some bills have 300 co-sponsors and never get a vote. Some bills have 5 co-sponsors and never get a vote. You don't really know. So you just got to start with the basics.
But to
Yeah.
Mike's point, it is generally speaking, a good rule of thumb to drum up as much support as you can.
You can't go wrong. Can't go wrong with that strategy as a starting point for sure. So, like I said, the more co-sponsors the bill has, the more likely it is to move through. But although we do want as many co-sponsors as possible, we don't want to take a shotgun approach and just reach out to all 435 members. That would be a really inefficient way of going about it. So we want to start with members we think are most likely to support the bill. That would be based on their background, or based on the committees that they sit on, and based on uh, positions on similar bills that they've taken in the past, or just any kind of clue that they're going to be likely to support. Also, we want to start with members whose credibility on this issue will attract other members. One of the first questions I get when I meet with a staffer is, who else is on this bill? Because members like to join their friends. It's a little like high school. So they like to follow what their friends are doing because they know it's cool. So we have a target list of about 100 House members, and the top of the list is the medical professionals in the House. There are about 16 doctors, nurses, or dentists. We're starting with them. We've met with all of those offices. We have 3 of those doctors, co-sponsors on the bill, and I'm going to go back to the other 13 over and over and over again, because like I said, they are our top priority. They're the most likely to attract other members.
And that gets to kind of the overarching point, which is to create a drumbeat, right? And with that drumbeat, it becomes an echo chamber, right? And that kind of helps build support and momentum and exactly what we need. And Mike's persistence, I mean, you cannot be too persistent in this work.
Right, right. So the next big group would be members of the Men's Health Caucus. I think there are about 30 members of that group. It's a very loose affiliation of members who have expressed an interest in this issue. Now, you might think that the caucus could all get together and vote that they're all going to co-sponsor this bill and it'd be done in one fell swoop. Unfortunately, it doesn't work that way. We need to go office by office by office and tell the staff, hey, guess what? Your boss is a member of this committee. He's already expressed interest in this issue. Should be a pretty easy lift to get there. Easier said than done. Because although a member and a staffer might express interest in a bill, they also have hundreds and hundreds of other bills coming in the door. So a lot of this is really just trying to stay on top of the pile of bills that they have to go through.
That's so right. There's a lot of noise, a lot of competing issues. And so it's the perennial challenge here in DC and in advocacy work, right? To stand out, to get through the channels, and to really elevate your issue and your ask.
Right. I think at this point, there are close to 10,000 bills filed in the House of Representatives. So we need to get our little bill elevated above that noise.
That's right.
The next group would be members of the House Energy and Commerce Subcommittee on Health. This bill has already been assigned to that committee, but there's no guarantee that the committee will take it up for a hearing and then for a vote. So we really want to get members of that committee to sign on to the bill. And then the next step with them would be to ask them to ask the chair of the committee to take it up in a hearing.
And just to connect the dots there, this is one of the 4 corners that we
Right.
alluded to earlier, right? So any health-related legislation has to clear all of these 4 corners in Congress to go further. So Mike's wise to focus his energies initially on those committees of jurisdiction.
Right. And we have a couple so far, but there's a lot of work to be done for that committee. The next group would be offices our advocates met with during the summit. As Vanessa mentioned, this is one of our asks that we made of offices during the summit. Turns out about 20-ish of those offices asked for a second meeting on the subject. And so we're going through and doing that. We know that at least one member signed onto the bill because an advocate asked them to during the summit. So that those meetings are really effective. I've had about 35 meetings so far out of 100. That's a pretty decent rate for only being in this about 4 months or so now. We have 8 co-sponsors, 4 Democrats and 4 Republicans. Now that party balance is very important. It attracts co-sponsors and it increases the chances of getting the bill advanced. For example, if there are a disproportionate number of Democratic co-sponsors, a Republican might not want to be on that bill, and vice versa. For that reason, the sponsor of the bill can actually control who gets added as a co-sponsor. So if a Democrat comes to him and wants to be added as a co-sponsor, Mr. Carter will wait until the Republican expresses some interest in that and add them both at the same time. They call this Noah's Arking or Jack and Jilling.
And this may feel a little counterintuitive to those of you listening. Why, if you've got a member willing to lend their name to this bill right now, why keep them waiting in the wings? And that really is because the appearance of bipartisanship is so critical. It might not feel that way watching the news at home.
Right.
But a lot of members, especially in an election year, are reticent to add their names to overly partisan bills, even if the issue itself is not a partisan issue, because we all know men's health is non-political. Everyone has a dog in that fight. But nonetheless,
I'll just echo that. Believe it or not, most members really do want to work on a bipartisan basis. Might not look that way on TV, but within the halls of Congress, it's true.
it's so true.
Yeah. So that's where we are in the House. Turning to the Senate, we're not as far along. What we're looking for there is an identical bill to be introduced by a Republican and a Democrat soon as we can. We've had many conversations with senators from both parties, and we think we're close, but I can't announce anything yet. Maybe the next time we do one of these podcasts, we'll be able to tell you what the Senate bill is.
Well, lift the veil just a smidge. That gets right at the importance of bipartisanship. Because on the Senate side, when it comes to introducing the companion version of this bill, the struggle that we've encountered is we've got one person willing and we're trying to find another person willing as to ensure, right, that the lead sponsors are bipartisan. So you have one Democrat and one Republican. Again, this is all in the spirit of bipartisanship. So the holdup has been not a lack of interest, but finding 2, Senate members willing to work with one another and be our bipartisan leads. We've got one, and we're closing in on another, but we're not quite there yet.
So once a bill's introduced in the Senate, just like in the House, we'll go to work on co-sponsors. But things are a little more challenging in the Senate. There is not a doctor's caucus. I think there's only about 2, maybe 3 doctors in the Senate. There is not a men's health caucus that we can go to immediately. There has not been a men's health bill in the Senate for many, many years. So there is not a group of senators that we can go to and say, hey, you already supported this. Why don't you support another? The group we will start with is members of the Senate Health, Education, Labor, and Pensions Committee. That committee has jurisdiction over HHS. So for sure, the people to start with are them. After that, we'll need to go really senator by senator by senator and look for clues that they might have some interest in this issue. The PSA for HIMSS Act, which deals with access to prostate cancer testing, PSA testing, would be a natural place to start. Senators who've expressed interest in mental health issues would be a pretty good place to start, and we'll come up with more and more as we move along. But for now, the name of the game is just getting that bill introduced.
And as a general rule, and when you think about it, it makes sense. The Senate is always a tougher nut to crack than the House.
Yes.
It is a smaller chamber. It is a chamber of 100 members versus the House, which has 439 members thereabouts, 435 voting members. So they're notoriously tougher to get, but gettable nonetheless, to Mike's point.
That's where we are on kind of our inside game of legislative strategy. Mel, could you talk about how we're gathering stakeholders to assist us with this?
Absolutely. So we've talked a lot today about cutting through the noise, right? We've mentioned how difficult it is to really get members' attention because they have things going on all the time. This is not their only policy issue they're thinking about, right? People are bringing them ideas and concepts left and right. So organizing and gathering external support is a powerful way to move things forward in Congress. And a great tool to do that is through coalitions. And coalitions are exactly what you think they are. They bring together a variety of stakeholders and organizations. And often with that comes, their unique experiences and expertise. And these coalitions do two things. One, it creates a larger and more unified voice for change, right? And it also lends credibility to your issue by showing policymakers, hey, look, this diverse group of organizations and people are agreeing about this particular policy issue, which in the name of DC, that is currency, right? To be able to come forward with, bipartisan support for whatever issue you have. And because our community collectively, the urologic community, has been advocating for a federal Office of Men's Health for about 25 years now, right? This is not a new issue. There are already organizations who are already supportive of this effort. And that's why the AUA is working hard to create a dedicated coalition of like-minded organizations. This includes patient organizations, research organizations, and physician organizations to help build the support we need to advance this bill, right, and to get co-sponsors. Now, that's at the organizational level. At the individual level, you, your friends, your families, your colleagues can reach out to your elected officials, your members of Congress, easily through the AUA Action Center. To make it easier for you, we actually linked this action alert in the description of this podcast, and you can find it all over our social media and website as well. But essentially, we have this action alert that lets you easily send a message to your members of Congress to request their support for this bill. The action alert lets you personalize your message. So if this is a personal issue for you, right, if this resonates in a deep way, if you have a man in your life, whether it's you or family or whoever, you can personalize that message and make sure that it really hits home, and you can add that to the voter voice action alert.
Yeah.
Um,
I can't overemphasize the importance of what Mel just said. Members want to hear from constituents. Plenty of people like me show up in their doorstep every day, and we're completely forgettable. Constituent voices create more of an impression. In fact, Dr. Murphy spoke at the annual meeting fairly recently on this issue, and he said the number one way to get this bill moved along in Congress is for constituents to contact their members.
That's right, Mike. I like to think of us not as totally forgettable. But we are registered lobbyists, and that does come with a certain degree of baggage. The constituent voice, especially on the House side, and particularly in an election year, it really is key to getting traction on this. And to Mel's point, it would be great if you wanted to personalize the form letter, but it's also not critical. Just clicking send is enough. So it's important to emphasize that.
Absolutely. And we urge you to waste no time in reaching out because, as Vanessa said, right, this is a volume game. So the more, the merrier. And as we said, it's linked in this podcast description on social media, as well as the AUA Advocacy Action Center.
Thanks, Mel. This was a great talk.
Thank you all. Yes, I mean, we're very excited about this, and I think that there is great traction, and it's quite a lightning time, right? All the kind of pieces are falling into place, and I think that we can move things forward in the next short time. So thank you all.
Thanks.
This has been an AUA News Inside Track podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.